Today's conversation: overcoming the burden of disease.
I kind of thought around a little bit about what we would discuss and the issue of the disparities in terms of the COVID-19 pandemic, in terms of who was being affected and how it was affecting persons. And there are a lot of issues that were raised, and I think one of them is the fact that we're seeing disproportionate amounts or a disproportionate burden of disease in persons of certain ethnicities. And I use the word ethnicity, although commonly we talk about race, and people talk about race being a political construct, not necessarily meaning that there are differences in us on a genetic basis. There are differences in terms of how we live our lives and how we practice. And so maybe a better word is ethnicity. But I did like the idea of having two R's in a statement. So the issue of race or risk is how I'm putting this. Are some of these disparities driven by ethnicity or race, as we may commonly call it, or really driven by risk? The next slide is some data from the US, and I was deliberate in not showing data from England because I knew I was among the experts. So when you're in this situation, you talk about what you know and not about what you think. But this is an infographic from the Centers for Disease Control and Prevention. And really, what it presents is a comparison of the rates of coronavirus, the number of new cases, those who were likely to be hospitalized, and also their likelihood of death. And they've broken it down according to the different ethnic groups within the US, and made comparisons with the Caucasian or white population, the white non Hispanic population. What you can see from this slide is that among every group, the risk of COVID-19 infection is higher compared to the Caucasian population. The likelihood of hospitalization is also higher, and the risk of death is also higher in most other groups, except for the Asian non-Hispanic persons. And if you want to focus on the Black or African American, that's fine. But you can see that we're seeing this in a number of non-Caucasian ethnic groups. And one of the caveats that they have here is that whether or not this risk is driven by something inherent to your ethnicity, or whether it is driven by other factors, and they've listed a few of them here, including our socioeconomic status, whether or not we are in the correct or the right brackets, or ability to access health and health care, and also the fact that the occupations that a number of persons in these ethnicities are involved in put them at higher risk of exposure to the virus, and therefore infection and hospitalization are important. But what has been emerging from a lot of the data that has come out of hospital registries is that a lot of these differences in ethnicity are not just driven by social factors, but are also driven by differences in non-communicable disease burden. And so that's what I want us to focus on a little bit for today. So the next slide actually gives you some of the data from Jamaica. And as Sir Hilary would have mentioned, there has been a shift in the causes of death. One of the things that people have failed to recognize is that this shift took place in the Caribbean long before it became very popular. So you can see that in the 1940s, where you had a lot of infectious conditions, tuberculosis and syphilis and pneumonia, as the leading causes of death. And from the 1980s, that pattern had changed, and stroke and heart disease and cancer had become the leading causes of death in Jamaica and a number of Caribbean countries. And we're kind of not surprised by this shift. I mean, maybe the fact that it had occurred a lot earlier than people had given credit to this transition taking place. But when we look at our survey data, we recognize that there is a high burden of risk. So the next slide actually shows some data from our last lifestyle survey. And this was a survey that was done with the Epidemiology Research Unit of Care and Jamaica's Ministry of Health and Wellness. And in this national study, we actually looked at the prevalence, or how common obesity was in our population. This included persons 15 and up. And what you can see here is how high the prevalence of obesity is in the population, particularly in our women. The women are in red, and you can see there are multiple times more likely to be obese compared to men. In fact, when we looked at the average weight of a Jamaican woman, her average BMI is 30, meaning that half of the Jamaican women are in the obese category and a half are under that category. And in the next slide, you can see some of the impact that this high burden of obesity has, because conditions like diabetes are more common in women compared to men, and that as the prevalence or the likelihood of having obesity increases, so does the likelihood of other chronic diseases. So here you see a high prevalence of diabetes becoming very common when you get into the older age groups. And the next slide will show some similar data for hypertension, where once people are in their 50s, almost everybody has high blood pressure. And this is the same in men and women. So we're dealing with a population which has a high burden of non-communicable diseases, a high burden of risk, and of course, because these diseases are often related or occurring in combination, we have what we call a lot of multi-morbidity. So people will be having multiple non-communicable disease conditions taking place at the same time that have to be dealt with. You have the high blood pressure, the cholesterol, the obesity, and so on. The next slide is actually just showing some of the trends that we have seen in Jamaica. From 2001, when we did our first national survey, to the most recent in 2017. And what you can see is that for all of these non-communicable diseases, the prevalence has continued to rise significantly over the years. So we know that we had an early transition to making this a big problem. We know that we've had a high burden of disease, and the burden is increasing. We recognize the role of history and other activities in terms of how we have come to this place. We have to think about what is continuing to drive this process, but also the issue of overcoming, because we see this now as our new challenge. When people were looking at issues of malaria and malnutrition 50 years ago, sometimes they may have felt daunted by the challenges that these health conditions would have held for them. But there are success stories, and in the same way that we've had success around many of our communicable diseases, I think we can also have similar successes when it comes to tackling the non-communicable disease epidemic. So putting everything in the context of COVID-19, the next slide I obtained from our principal or chief epidemiologist, Dr. Karen Webster Carr. She gave me these slides last night. This is the latest COVID-19 statistics for Jamaica. And what this is showing is just a graph of the number of cases that have been taking place in the country from the beginning of the pandemic in our region. That was about March last year to now. And for a long time, everyone had expected that we'd have seen the numbers that we are seeing now, the ones that you see highlighted in March, very early on. And that was not happening. And so everyone was speculating as to why, the Caribbean is doing so well, while other places are falling apart and systems are being overwhelmed. We've managed to keep our numbers down and not have a high burden or health system overwhelmed by the disease. Well, there's no special protection. Well, let me not say that, because I'm in a religious setting, so some of us are protected to some extent, but there wasn't anything that was special about the Caribbean, because a lot of speculation was about, oh, it's a sunshine that is preventing the disease from spreading, or it's you're in a hostile environment, and so a lot of the stresses and so on that are created by those settings are probably what are driving the pandemic. But what we have seen is that we also have the capacity to be overwhelmed by the pandemic in much the same way. And the next slide actually shows what happened to Jamaica once the numbers started to go up. So initially, when the pandemic started, that straight line is the number of beds. That red line at the top is the number of beds that they had for patients who had COVID-19. And for months, everybody was saying, what a waste of our resources, all these beds and nobody in them. Well, by about March, people are asking, where are the beds? Because we don't have anybody, anywhere to put people. And we can see that in the same way that other systems can be overwhelmed. We too can be overwhelmed by this infectious disease. And the last slide I'm going to show is really that this is coming on the background of a high burden of non-communicable diseases. So we recognize that we are at risk, and the non-communicable disease burden will predispose us to having a lot of adverse outcomes from this pandemic. These are just data looking at the deaths that have taken place in the region over the last year. And one of the things that they have found is that in almost every single case of death that took place, these persons suffered from a comorbid illness. Maybe the prevalence or the rate of some of these comorbid illnesses don't appear to be very high, like obesity. I suspect that's probably because these are routine data, and sometimes information about weight and height is not recorded. But in addition to age, being over 60, we can see that cardiovascular disease, including hypertension and diabetes or kidney issues, were present in persons who had suffered from this condition. So we recognize now that non-communicable diseases are a big threat to us, not just in terms of what we can expect from them, but as we've seen from this pandemic, the predisposition that it puts to us in terms of putting us at risk for other conditions that we hadn't even thought of. But of course, this symposium is about overcoming. And I think one of the things that we want to have a frank discussion about is issues around how we can overcome this particular burden or this overemphasis of risk, and what are some of the challenges and things that we can do both on a personal level but maybe on a sort of wider level to try and address what is happening now and reverse some of the trends that have been maybe part of our culture but don't necessarily have to continue to be part of our culture if we see ourselves making a change.